this is Angela with Angela's Nurse Toolbox. Let's learn about giving blood safely to our patients, knowing our different blood types. So the different blood types we have up here are O negative, A negative, B negative, and AB negative. We also have O positive, A positive, B positive, and AB positive. So when we have these are little t-shirts. This is a visual way to help you learn and understand blood types. So the A negative has an A antigen on it. So this can only go to blood types that have an A on it. The B negative only has a B antigen on it. So this one can only go to type B blood. This AB negative has a B and an A, so it can get anything with a B or an A. These right here, the positives, all have something extra, okay, on their blood types. So their body, these positives can't go to any of the negatives because they don't have this part. This is something extra. So the positives I have represented with the little yellow part on it, the little squares, to show you the different positives. So let's kind of go ahead and talk about the different blood types. So O negative is our universal donor. This one can be given to anybody in case of an emergency when we don't know what their blood types are. We can give O negative. If you ever watch the medical dramas on TV, you will always see them say, oh, I need 4 units of O negative stat. We don't have time to get their blood type and wait for the results because somebody might be hemorrhaging. So O negative doesn't have an A or a B on its sleeve. It doesn't have anything extra. So that's why it can go safely into the A, to the B, to the AB negative, and it can safely go to O positive, A positive, B positive, and AB positive, because it didn't have an extra antigen that your body would detect as abnormal. Now let's go with the A negative. A negative has an A antigen on it. So negatives can only get negative blood types. That's very important to know. So if you have a patient that is negative, has an RH factor that is negative, they may only receive negative blood types. So here we have A negative. This one has an A on it. You might see the AB negative also has an A on it. So this one can safely go into AB. AB is the universal recipient, so they can safely receive anything. So an AB negative has both the A and the B on it, so it can get A negative, B negative, or O negative. So this one can go to anybody. You can receive it to anybody. With the O positive, now this one has something extra. O positive can get O negative. It can also get O positive. Now here's our A positive. A positive. So positives can receive negative blood types. They have this. They already have their little extra on it. So it can get an A negative. It can get O negative, O positive, and A positive. This B positive has the B antigen, and it's positive, so this one can get the B because they match, the B's. It can get O negative, and it can get O positive as well as B positive. Now, AB positive has both B, A, and this RH factor. So AB positive is the universal recipient. So it can receive any of these blood types because a positive can receive a negative. Because this one has a B and an A on it, it can go. This one has a B, can go to this person, and A. So if you have the blood type AB positive, you are very lucky. You can get any of the blood types. You don't have to sit and wait for your specific blood type to come into the blood bank. So let's talk about, we have a patient that has B negative blood. Okay, using this chart, we're going to look, it says RH negative, B negative. Here's our B negative. It has the B antigen on it. What blood types can they safely receive? Remember we talked about negative blood types can only receive negative. So we know for sure we can get B negative and O negative, because this one's the universal donor. Okay, because they both are the same. Now we can't get a positive because this negative is going to pick up on this extra bit and it can cause a transfusion reaction because you don't have this extra bit in negative people's blood. So B negative can get B negative and O negative only. Let me talk about a few other ones I have. All right, here's our AB positive blood type. So AB positive, that one's down here. This one has a B and an A, and it has a positive RH factor. So it can get any of them with the A or the B, or with nothing on them, and positives can receive negative blood types. So it can receive any of these blood types with AB positive. Let's do another example. Let's do A positive. A positive is right here. It has the A antigen on it. And here's our RH factor saying it's positive. So which ones that we can get? We can get this A negative, because negatives can give to somebody who's got a positive blood type because they both have the A. It can also get O negative because that's our universal donor. And O positive, because we already had that. It didn't have an A or a B on it. So those are the 4 blood types you can get with A positive blood. Let's do the last one. We have O positive. So here's our O positive. You note that there's no an A, there's no B on here. So we don't have those antigens. And this one's a positive RH factor. So with O, we can only get an O. That's it. So O negative can go into the O positive and O positive. So that's our only 2 choices. If I'm O positive, I can get O negative or O positive. Now if you have O negative blood, you can only get O negative blood. So I hope this helped you learn about the different blood types in this visual way. If you like, subscribe to my videos. This is Angela's Nurse Toolbox. Thank you.